Hi, my name is Erica Johnson, and I'm the Director of Marketing at Wilson Medical Center. For generations, our hospital has been caring for people inside this community, and one of the most powerful ways we can do that is here in our radiology department. Radiology is where our providers can look inside the body without a single incision. It's where problem solving meets technology and where answers begin. If you're curious, you like science, and you want to help people make a really large impact, then radiology just might be the healthcare career for you. Let's take a look.
I chose radiology because when I was young, I worked in a hospital and I was a candy striper as a volunteer. And I got to walk patients from the beginning to the very end. And I would walk the patients to radiology and they would be, you could tell they were scared. I wanted them to feel comfortable, and just watching the patients go through there, and by the time I left them, making them feel more comfortable and at ease. I knew it was something I wanted to do, at least in the medical field. What I love most is when the patients come in, they may be worried about finding out if they have cancer or what disease they have or just the unknown. And once they get here, helping them feel comfortable, helping them know that I care, I truly care, and that when they walk out that door, they know someone cares and made a difference in their life. I had a patient get smashed with a cow up to a fence, and his bones were sticking out of his legs going different direction. So you have to think outside of the box. How do I get these images for the doctor? You can't do what you normally do because bones are going everywhere. So it's fun and it's more intriguing to me because you definitely have to figure out how can I get two views of that body part to get to the radiologist to be read. So to me, it's challenging, so I like that part. Nowadays, there's a lot of students that are getting their associate's degree while they're in high school, which is great. Highly recommend it. But make sure you get the prereqs you need for the program. And then your program can be 2 years, and you will need to be registered with the ARRT, and you will have to be licensed in the state of Kansas. Some states do not require you to be licensed, but in Kansas, you are required. So if you want to go on farther, you can get a bachelor's degree and do it in 4 years. But 2 years is the minimum. It's a lot better than being a doctor and going 8 years. There's really good money in radiology. There's high demand right now in radiology. So 2 years, a little bit of experience, high demand, guaranteed to get a job. Science, math, any A&P classes. A lot of people think that going into radiology has to do with just math and science. You don't have to be a pro at math or science, but you've got to have some basic knowledge of problem-solving skills. So if you're not perfect in math or science, no, you're still going to be okay. Someone who's calm under pressure, they can handle stressful situations, and someone that likes to take care of patients and not be by their bedside all day, like a nurse. They're with the same patient all day. We'll get 11 on our patients for a little bit, and then they're out the door. Radiology can see inside. The doctors can't see what's inside. They can guess what's going on inside with that patient, but we get to see exactly what's going on inside that body, different than anyone else, which is really fun. You never know what you're going to see. So the future of radiology, I just see it being able to diagnose patients so much quicker. When I started radiology, we had a single slice CT machine. Now they go all the way up to like 640 slice CT. So being able to catch that tiny little cancer sooner, anything with mammo, little tiny things, lungs and CT, just the advancement of all the equipment is going to make diagnosis so much quicker and scans faster, less radiation to the patients. The advice I would give a high school student is job shadow, 100%. Don't just do it in one place. Go to the hospitals, ask if you can job shadow, watch everything from A to Z. Don't just do it quick and think I'm done. I mean, I really think you should go in, watch everything, ask lots of questions.
We hope you enjoyed our radiology department today and a look inside of all the different modalities. From CT to X-ray to ultrasound, there are a plethora of modalities to choose from. But we want you to remember, no matter what career path you choose, choosing one in healthcare will make a lasting impact.